in clinical practice, in order to complete a comprehensive exam, it is important to include radiographs based on the AAPD indicators when working with a pediatric patient. Some of the important techniques to remember are desensitizing the patient, so explaining the procedure thoroughly in layman's terms and using words and relating it to things that a pediatric patient may be able to relate to. Also, including the parent on the process can make it easier, such as having the patient sit on the parent's lap or having the parent restrain the child, not the clinician. It is also important to remember to take the easiest film first. That will help with the process, make the child seem like it's easier than the task at hand, and that will increase patient compliance. Taste is also a factor with children. If something does not taste right, they will not keep it in their mouth. So what you should do, or what you can do, is you can use a lollipop when taking anterior films, having the child lick the lollipop and then sticking the film onto the lollipop and holding the lollipop in the place where you need to take the x-ray. Also, you can use toothpaste when taking posterior x-rays. You can rub the toothpaste on the back of the film. That way the patient tastes the toothpaste and not the film. Also, controlling the gag reflex is important when working with a pediatric patient. You should always use the distraction and positive reinforcement technique with that. You want to encourage the patient to increase patient compliance.
Hi Erin, how are you today?
Good.
So I heard that you just had your cleaning. How did it go?
Good.
All right. So you haven't had pictures taken of your teeth in a while. We do call them x-rays. Do you remember last time you had them done, or do you ever remember having them done?
I don't know if I've ever had them done.
Okay, they are super easy. We have a few different ways to do it. We're going to take pictures of your front teeth. Mom said that you did fall last week, and it's still bothering you a little bit.
Hurts, yeah.
Is it wiggly at all?
I hope not.
Okay, we can take pictures today, and we'll see what's going on under there. And we're also going to take pictures of your teeth on the side. Those pictures are going to show us if you have any cavities in between those teeth. Those pictures will show us anything that we can't see when you're sitting in the chair with the mirror that the doctor uses.
Okay.
Do you have any questions? Okay. Since you don't remember, I am going to show you. I do have a little mouth over here. So the first picture that we're going to take of your front teeth to make sure that they're not broken under your gums, it's just going to bite down right on this little blue piece. And this is my camera, and the camera's going to point right at your nose.
Okay.
So that's how we do the first one. And again, I'll show you a little bit more before we actually do it. And then we have the same one. Just looks a little different. This one's red, and this is to take the pictures on the side. See how you're going to bite down?
Mm-hmm.
So you just bite down just like this. And this little ring is going to touch your cheek. And again, my camera points right there. All right?
Mm-hmm.
So first, we're going to get you ready. I am going to have you wear this apron. This apron just protects you. This just makes sure that we only get pictures of your teeth because we don't want pictures of any other bones in there. All right. And I am just going to need you to lift your chin up. We're going to make sure it's nice and tight around your neck. Perfect.
Can I take my hair out?
Sure. I know it's a little uncomfortable.
Yeah.
There we go.
Okay.
Is that better?
Yeah.
All right. Let me just take this a little bit more. Perfect. And I'm going to give you a little bib. All right. Now I just need to put on my mask to protect us from each other's germs, and my glasses in case you sneeze, and then my gloves because we don't want to put my dirty hands in your mouth. No way. All right. So the first one is we're going to take is your front teeth. So I'm going to have you, again, it's going to go just like this, and my camera is going to point right at your nose.
Okay.
So I'm going to have you open nice and big, and bite down. Perfect. I'm going to have you stay super still. I'm going to run out of the room. And when you hear the beep, you can slowly open, okay? You just say super still. Beep. All right, and you can open. Awesome job. How was that?
Good.
Oops. All right, and the next one we're gonna take other teeth for the teeth on the side.
Okay.
So remember, I'm gonna have you bite down right here, and this is gonna go in between your tongue and your teeth.
Okay.
All right. Have you open nice and big. All right. So we're gonna try it again, okay?
Okay.
I need you to listen to my directions. You're gonna breathe in and out of your nose. Okay. All right, and slowly bite. Good job. Real quick, stay nice and still. You're doing so good, Erin. Beep. Awesome, go ahead, open. Good job, Erin. All right, and we do have one other thing. We're gonna try it on this side to see if this is a little easier for you. It's kind of the same thing as the red piece that we used, but it might make it actually a little bit easier for you. And this time, I'm actually gonna have you lift one of your legs when we're doing it, okay?
Okay.
I'm gonna have you breathe in and out of your nose, and lift your leg, and bite down, bite down. Good job. Stay nice and still. Beep. Awesome, open. Awesome, Erin. How do you feel with that?
Good.
All right, not as bad as you thought, right?
No.
All right. So what I'm going to do now is I'm going to go take these films and I'm going to develop them, and we're going to show you with a light what your teeth look like.
Okay.
All right? All right. Hi, Erin. I have your films. They're right here. I just want to show you a couple things that I think you might find interesting before the doctor comes in. So if you want to stand up, you can come right over. So these are the pictures. These two, we call them bite wings, and these are the ones that show your teeth on the side. So you can see in between your teeth. And actually, if you look right here, this is one of your molars that haven't erupted yet. So you can see your teeth and they're not even in your mouth yet.
Wow.
Pretty cool, huh? And you also see these little white spots up here. Those are your adult teeth, and those are pushing your baby teeth out. Pretty cool, huh?
Yeah, that is cool.
And then this one right here, this is the x-ray that actually showed your front teeth from when you fell last week. And everything looks really well, but we are going to have the doctor come in, take a look, and explain into further detail with you and your mom. I just thought it was important to show you what they look like, so next time you have a little bit more of an idea of what we're going to do.
Okay, cool.
Pretty cool, huh?
Yeah, thank you.
You're welcome. Do you have any questions?
No.
All right. It was very nice meeting you.
Nice to meet you.
And we will see you in 6 months for your next cleaning.
Okay, thank you.